In a trauma situation, the medical team has precious minutes to assess the situation, make critical decisions, and act on them. Sometimes doctors are treating things they've only seen in textbooks or have briefly been exposed to at some point in their education. I don't think the general public understands the impact, the number of lives that could be saved by improving medical training. The improvement decisions almost always come down to money, which sounds terrible when you have to tell someone their loved one just died.
In medicine, like almost anything else, practice leads to improvement. But traditional teaching is disconnected from reality. How can we prevent a wrong diagnosis? Enter high-technology simulation. This interactive simulation gives health professionals access to a learning environment that is high-tech and high-touch. Instead of learning from observation, there's the chance to do, with a mannequin that acts and responds like a real human would. From urgent trauma situations to routine medical procedures, simulations can be run in real time with immediate feedback on treatment. This is the most realistic way to practice, short of treating a real human being.
The question I ask myself is, why wouldn't we want to give healthcare workers better learning opportunities? The military runs simulations before they send soldiers to battle. Airlines require pilots to go to simulators frequently to prevent accidents and to enable them to land in the Hudson River. Why wouldn't we want healthcare professionals who literally have our lives in their hands to have the same kind of practice opportunities?
At the University of Arkansas for Medical Sciences, Arkansas's only teaching hospital, medical simulation is imperative. Not only are the majority of the state's doctors trained here, many hospitals and clinics statewide look to UAMS to further training of their staff.
Having a simulation center is critical because it develops both confidence and skills, both of which are essential for good patient care.
This is a new way of learning, a better way of learning. Students need real situations. They need to learn what can happen and how to react.
Though spending time in the simulator is stressful, you feel like you're performing, people are watching you, you know that you're dealing with something that is potentially life-threatening. Even though you know you're practicing, it seems to put you still at a level where when you're in with a real patient and something truly happens, you have the ability to step back and think, going, oh, I've kind of already been here before, or just allows me to deal with stressful situations better and be more effective for my patient.
Simulation is important for our students on many different levels: critical thinking, decision making, and clinical techniques. They can just say, I've done that before, I know how to do it, and then they just do it.
It's simply about learning with the hands. As doctors, our hands are where we connect with patients. We have to teach that.
It is the goal of UAMS to expand the current simulation department to an entire center that covers the most essential trauma and emergency situations. This will become a place where all healthcare workers can come to practice their craft.
There's an urgent need for a comprehensive medical simulation center here at UAMS. We have a great curriculum, but the latest simulation technology would allow us to replicate working on a real patient. We need this technology. It's essential for our students. As a patient, would you want to be treated by a physician who just read the book, or the one who has also performed the procedure to perfection? Our students need this technology. But more than that, the people of Arkansas who depend on UAMS need us to have this technology. We must depend on philanthropy. I personally believe that this can affect the health of patients in the future and can help us bring good news to families. That's worth a lot.